Excellent message. I'd love to see the full 15 pages. The faculty members and students of the University of Guyana, my dear colleague Dr. William Adukro, PAHO WHO representative from the Ministry of Education, the media. Good morning. So thank you for this opportunity to offer some remarks on behalf of the United Nations and the country team here in the first ever Mental Health Fair. World Mental Health Day is observed on 10th of October every year with the overall objective of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. According to the United Nations Department of Economic and Social Affairs, persons with mental and psychosocial disabilities represent a significant proportion of the world's population. Millions of people worldwide have mental health conditions, and an estimated 1 in 4 people globally will experience a mental health condition during their lifetime. Mental health is not merely a health or medical concern, as Professor Mohammed has eloquently mentioned. It is very much a matter also of human rights, dignity, and social justice. However, nearly 2/3 of persons with mental health conditions will not seek treatment for their condition. Stigma, among other issues, is a significant determinant of quality of care and access to the full range of services required by persons with mental health conditions who also have physical complaints. In some countries, the absence of community-based mental health care means the only available care is in psychiatric institutions, which are often associated with gross human rights violations, including inhumane and degrading treatment and living conditions. In 2015, the Sustainable Development Goals were adopted by the member states of the United Nations, and mental health and substance abuse was explicitly included in this global agenda with the promotion of mental health and well-being and the prevention and treatment of substance abuse as health priorities, specifically Goal 33 of the 17 Sustainable Development Goals, focusing on ensuring healthy lives and promoting well-being for all at all ages. The inclusion of non-communicable diseases brought greater attention to these diseases. Through their 169 interactive and synergetic targets, the SDGs seek to move the world towards greater fairness that leaves no one behind. In his message to mark World Mental Health Day, the UN Secretary General, Antonio Guterres, notes that this year the focus is on young people, since half of all mental health conditions start by the age of 14. He highlights that poor mental health during adolescence has an impact on educational achievement and increases the risk of alcohol and substance abuse and violent behavior. Violence against women, physical, sexual, and psychological, results in lasting scars, including post-traumatic stress disorder. Yet despite these challenges, a great deal of mental health conditions are both preventable and treatable, especially if we start looking after our mental health at an early age. In Guyana, the United Nations continue to work to ensure that the 2030 agenda is fulfilled and that no one is left behind, and particularly through the PAHO, Pan American Health Organization, and the World Health Organization works vigorously to ensure that persons with mental health problems are no longer marginalized. And I would also add that, already mentioned, UNICEF is supporting the University of Guyana in the establishment of psychology programs. I close by echoing the sentiments of the Secretary General. Indeed, if we change our attitude to mental health, we change the world. It is time to act on mental health. Thank you very much.